Beatrice.
Hi, Castella. How are you?
I'm good. So I just remembered we have something planned for the weekend.
Okay.
And I'm wondering, before that time, I'm just imagining, like, if I wake up that day and I'm just not in the mood to have that weekend. Have you experienced such a client who you are ready for the session and then you found them in such a way?
As a counselor at Macheo Children's Organization, I've ever encountered such a client. And she used to be moody, especially in the morning. When she wakes up, she doesn't feel like doing anything. And most of the times also she would find herself crying out of nothing, and she doesn't know what she's crying for. So we had sessions with the client as a form of self-care. Whenever she feels that way, there are some things that she can do. That is, watch a video. I also psychoeducated her about nature and the way nature heals the mood. And she was good to go.
And has that ever worked for you?
Yes, mostly what works for me is the nature walk, and even going somewhere where there's a waterfall. Immediately when I engage my mind on that site where the waterfall is, I feel relieved and my mood changes.
As a counselor in Macheo, I was trying to include my clients in using nature walk during one of our techniques. They experienced something traumatic in a nature trail. When I mentioned exposure therapy, you see, go back there, breathe in, take in the environment, but that is now where the trauma happened. One of the other techniques I tried to include them is, first I showed them that I'm really listening to you. I'm hearing what you're saying. And every time I could see them pause, I was like, keep going, I want to hear you more. The information they would give me, another technique I would include was like, I would reflect on their statements and rephrase whatever they are telling me to try and give them a meaning of what they experienced. Another technique sometimes I included was cognitive restructuring. I'm trying to restructure their thought process. Yes, this happened, but the environment is safe for you. Like, if using your example, nature, and the same thing happened to my client, but it's where they would have gotten their self-care is where the trauma happened, and we had already had that session. I'm sure something will come out of that.
We as Macheo counselors, during this month of mental health awareness, we advocate for each one of us to take action and mind about people around us. Sit with someone, provide a listening ear, hear them, and encourage them.
As a counselor in Macheo Children's Organization, I've spoken about techniques during in session, but out there, you'll also meet your fellow members, fellow colleagues, families, friends who have healthy coping strategies. Listen to what they share. Copy them if possible. I would encourage you, any way someone has used to take action in their mental well-being, use it as well. It might work for you, it might, but now you will know, as long as it's a healthy way of coping when you're struggling.
Take care of yourself.
You
know, the environment we live in heals. Grab that opportunity of going to a place where there's a waterfall, of going to a place where there's nature. You listen to the voice of birds singing, and you engage your mind. When you come out of that place, your mind will be very fresh.
Go back, retrace your steps back to when the event happened. The thoughts that made you act the way you're acting right now, the feelings. Ask yourself, whom are you affecting? When you take care of yourself, you're also taking care of those around you, because we need each other.
Practice self-care, mind about your thoughts, mind about your behavior, take action of your mental well-being. And know that your mental well-being is not an afterthought, it's a priority.
Very, very true.